Hello everyone and welcome to Star Health Insurance YouTube channel. I am Dr. Manjunath Pandit, intervention cardiologist, welcoming you all to address alarming health concern as to why hypertension, prediabetes and diabetes is on rise in Generation Z. These silent yet serious conditions are affecting more young people than ever before. With the right understanding and preventive measures, we can combat these health risks. Let's explore why these conditions are on rise, especially in Gen Z, and what steps can be taken to manage them. So let's understand what we have for today's video. First, we will start with an overview of rising hypertension, prediabetes and diabetes in Gen Z. Moving ahead, we will discuss the pathogenesis of hypertension. We will understand how blood pressure works and what effect it possesses. We will also study about prediabetes and diabetes, its causes, types and symptoms. We will also look and dive deeper into the risk factors that are specially associated and seen in Gen Z, how their lifestyle and health challenges affect the occurrence or the incidence of prediabetes and diabetes. We will also see what complications does this prediabetes, diabetes and hypertension have on humans, their impact on heart, kidney, eyes and nerves in form of chronic diseases. We will discuss on the prevention and management, key strategies for reducing the risk, and in conclusion, essential health tips for healthier lifestyle. Heart is a dynamic structure which pumps blood in and out from inception to death. Pressure exerted by blood and its constituents on the wall of the blood vessel is termed as blood pressure. If you have a high blood pressure, the force of the blood pushing against the arterial walls is consistently too high. The heart has to work harder to pump blood. This damages your arteries over time and can lead to serious complications like heart attack and stroke. Both hypertension and diabetes are termed silent killers, as often individuals suffering from either or both won't have symptoms until the advanced disease state. This lack of symptoms may tend to make an individual deny the disease or even refuse treatment altogether. Shockingly, World Health Organization estimates that 46% of adults with hypertension don't know that they have it, and around 1.2 billion people globally suffer from hypertension. When we talk about hypertension, there are two numbers that we know of. The top number is the systolic blood pressure, which measures the pressure on your artery wall when the heart beats or when it contracts. And the bottom number is called as a diastolic blood pressure. This measures the pressure on your arterial walls between beats. That is when your heart is relaxing. Blood pressure of 120 by 80 mm of mercury is considered normal, and pressures between 120 to 139 for the systolic and 80 to 89 for the diastolic are considered high normal. And an elevated blood pressure of more than 140 by 90 mm of mercury is called as hypertension. Medically, there are two types of high blood pressure. They are primary and secondary hypertension. Primary hypertension, when you are suffering from hypertension without any underlying disease or cause, which is usually the cause accounting for up to 90% of the cases of hypertension. Then comes secondary hypertension, where you are suffering from a hypertension with an underlying disease or a cause, typically a kidney disease, endocrine abnormality or a heart disease. Since your blood pressure is a dynamic reading and may vary based on various factors, it is essential to standardize the method of diagnosis. Factors ranging from physical to mental spectrum can influence your blood pressure recordings. Diet can influence your BP on a day-to-day basis, with high sodium diet often being a common culprit. If you fall into a high normal blood pressure subset, it is particularly important to self-monitor and keep a tab on your pressure recordings. At times, self-recording can even overestimate your blood pressure due to anxiety and anticipation. There is a phenomenon which is known as white coat hypertension, a situation when an individual has a higher blood pressure recordings at clinic or hospitals, while a normal blood pressure recordings are noted when measured at home. If such a situation is suspected, your physician or cardiologist would recommend a 24-hour ambulatory blood pressure measurement, which measures your blood pressure over the period of 24 hours at an interval of every 5 minutes, giving an average blood pressure recordings. By this way, we will have an average recording of BP in the daytime, in the nighttime and over the 24 hours. On the contrary, a condition exists known as office hypertension, where an individual will have a normal blood pressure recordings at clinic and higher blood pressure recordings which are taken either at home or at office. These can be attributed to either an emotional or a physical triggers. Your physician will help you in diagnosing the type of your hypertension and in ruling out any underlying organ dysfunction. Hypertensive patients are predominantly asymptomatic, but in some individuals, BP may shoot beyond 180 by 100 mm of mercury and produce symptoms. These symptoms can be headache, palpitations, blurring of vision, giddiness or confusion, or difficulty in breathing. At times, some individuals may frankly present with a full-blown heart failure. Now moving ahead to prediabetes and diabetes, before we start our discussion, I want to educate you about an organ which is quite important in preventing us from having a diabetes or a prediabetes, which is pancreas. It is an important organ located at the center of our abdomen, produces three important hormones, namely somatostatin, glucagon and insulin. Insulin is essential for glucose metabolism and cellular uptake. Disease affecting either the production of insulin or its resistance leads to diabetes mellitus. Now, diabetes mellitus is a chronic metabolic disorder that affects millions of people worldwide, characterized by an elevated blood glucose levels. Diabetes results from either insufficient insulin production or the body's inability to use insulin effectively. So that means either the insulin production is deficient or it is adequately produced but not utilized properly. The condition can lead to a range of complications affecting almost every organ system in the body. As the prevalence of diabetes continues to rise due to factors such as obesity, sedentary lifestyle, aging population and active surveillance, that is more people going for their annual health checkups, it is important to understand the types, causes, symptoms, complications and management strategies in these patients. Prediabetes is a situation where the pathological process of the disease is in progress with impaired glucose tolerance. And if the individual doesn't resort to lifestyle modification, full-blown diabetes is inevitable. Easiest way to know your diabetic status is to get a glycated hemoglobin checked. Normal levels of glycated hemoglobin, also known as HbA1c, should never exceed more than 5.7. If your HbA1c levels are between 5.8 to 6.4, you may be pre-diabetic and will need further testing. And it is time to pull your socks. It is estimated that every 1 in 5 Indian is diabetic. And there is a rampant rise in the proportion of people with prediabetes, especially in the age group between 30 to 45 years of age. So what are the risk factors in the development of hypertension, prediabetes or diabetes? The number one risk factor which is quite on rise is smoking. The risk of developing hypertension or prediabetes multiplies with the number of cigarettes per day. And the second risk factor that we can talk about is a family history. An individual who has a family history of diabetes in a mother or a father is at an increased risk of developing the same. Then comes type A personality, overweight and obesity, sedentary lifestyle. Any form of consumption of alcohol is also a significant risk factor for development of any of these comorbidities. Unhealthy eating patterns as well is an established risk factor for development of prediabetes. There are mainly two types of diabetes based on the timing of its onset. They can be classified as type 1 diabetes and type 2 diabetes. Type 1 diabetes is congenital, found in children, where the cells which produce insulin are destroyed by one's own immunity. And the individual is dependent on the external source of insulin throughout the life. So this individual, we don't have any medications to provide. Type 2 diabetes is more common and is primarily associated with insulin resistance, where the body's cells do not respond adequately to insulin. Here, the insulin production is there, but there is a resistance of insulin at the cellular level. This type often develops later in the life, typically in adults, but is increasingly being diagnosed even in children due to the rising obesity rates. These individuals can be managed with medications as well, unless they go into an advanced state where they would need insulin supplementation. Newly affected diabetic individuals may have no symptoms for as long as an year, making it more difficult to detect unless we actively screen these individuals on a regular interval. Advanced diabetics may have symptoms such as polyuria, that is excessive urination, polydipsia, that is excessive thirst. There can be weight loss and development of cataract at an early age. There can be a loss of pain sensation in the foot or numbness, which can lead to formation of a non-healing ulcers in the leg. There are also an increased evidence of recurrent infections, especially the upper respiratory tract infections or urinary tract infections. Untreated diabetics who have a higher blood sugar for a longer periods will primarily have diseases of 4 vital organs. Number 1 is heart disease, such as heart blocks, heart valvular disease and heart failure. Number 2 comes diseases of eye. They can be cataract, retinopathy and eventually can lead to blindness. Third comes kidney disease. It can range from a simple protein loss to full-blown chronic kidney disease who may even be dialysis dependent. And number 4 is neurological, where there can be a loss of sensation, numbness or early incidence of stroke as well. The diagnosis of diabetes is typically made through blood tests. Common methods include a fasting blood glucose test, an oral glucose tolerance test, and a hemoglobin A1C test, which is also known as a glycerated hemoglobin. This provides an average blood glucose levels over the past 2 to 3 months. Diagnostic criteria include fasting glucose levels of more than 126 mg per dl or higher, and a 2-hour glucose of more than 200 mg per dl, or an impaired oral glucose tolerance test, or an HbA1c of 6.5 or higher. Effective management of diabetes involves a comprehensive approach that includes lifestyle modifications, monitoring, and if necessary, medications. Coming to lifestyle modifications, a balanced diet which is rich in whole grains, fruits, vegetables, and lean proteins is essential. Include food which has a lower glycemic index such as oats, chickpeas, apple, and carrot. Regular physical exercise is also crucial for maintaining a healthy weight and improving insulin sensitivity. Coming to the medications that we can offer to the diabetic individuals is individuals with type 1 diabetes, as I said, will require insulin therapy administered through injections or via a insulin pump. While type 2 diabetic patients, managements may start with oral medications like metformin, which may help improve insulin sensitivity and reduce glucose production in the liver. As the disease progresses, additional medication or insulin therapy may be necessary. When it comes to monitoring, regular blood glucose monitoring is vital for individuals with diabetes to prevent complications and maintain target blood sugar levels. Healthcare provider recommends periodic glycated hemoglobin test to assess long-term glucose control. Diabetic education programs empower individuals with the knowledge and skills needed for an effective self-management. Support groups can provide emotional and practical assistance as well. The recent rise in the incidence of hypertension, prediabetes, or diabetes in individuals aged between 30 to 45 may partly be because of an active surveillance, increased health awareness, or the advances in science which can detect the disease at an early stage. Don't be disappointed if you are diagnosed with prediabetes. Consider it as a blessing in disguise, as lifestyle modifications can postpone the incidence or the occurrence of full-blown diabetes by 10 to 15 years. So that's all for this video. If you have liked this video, hit the like button, comment with your queries below, and don't forget to subscribe to Star Health Insurance YouTube channel for more valuable insights. Thank you.